Our names are William R. Halstead, Rebekah S. Sandlin, and Emily R. Taylor. This is our first treatment team staffing for SW7010 differential diagnosis for the second summer module for the summer 2021 quarter at Louisiana State University Agriculture and Mechanical College. For this assignment, for treatment staffing, we have elected to review Case Study 3.1 by Donald M. Hilty and Michael B. First's DSM-5 Handbook of Differential Diagnosis. In this case study, an African American man was transported to the emergency room because of his behavior, sexual inappropriateness, and delusions. The client, Mr. Mark Hill, is a 34-year-old African American man who has an odor, shows poor impulse control, and appears delusional, calling himself the new Jesus. The details of his case will be presented in the following slides.
The client, Mr. Mark Hill, is an African-American single male at 34 years old. He was brought to the emergency room by the local police department with concerns regarding possible schizophrenia diagnosis and demonstrated erratic behaviors, which will be discussed in more detail on the following slides. He was administered lorazepam and haloperidol and transferred to the psychiatric unit within the emergency room.
Mr. Mark Hill was brought to the emergency room by two police officers. The nature of the initial call to law enforcement is unknown. While being detained by the police officers, Mr. Hill was sexually inappropriate and offered to pay the two officers for sex while he was in the back of their patrol car. His relevant symptoms include 1. Sexually inappropriate behaviors. Mr. Hill had offered to pay the two police officers for sex. This happened while he was in the back of their patrol car. 2. Mr. Hill is experiencing delusions. He was referring to himself as the new Jesus. When asked, he refused to or was unable to provide another name. His actual name was unknown until after his sister arrived at the hospital. 3. Physical agitation. Mr. Hill was unable to remain sitting in the emergency room, even after being instructed. Instead, he ran through the emergency room. He had to be physically placed in restraints. He was also given 2 milligrams of lorazepam and 5 milligrams of haloperidol. If he had shown any signs of adverse side effects from these medications, such as extrapyramidal or drug-induced physical motor effects, the staff were prepared to administer 50 milligrams of diphenhydramine or Benadryl to him intravenously. Mr. Hill, even after having been administered these medications, remained giddily agitated and talked about receiving messages from God. 5. Lack of sleep. Mr. Hill reports that he no longer needed sleep as heaven had touched him. 6. Speech. Rapid, disorganized, difficult to understand. 7. After he continued to remain agitated 45 minutes after receiving the doses of lorazepam and haloperidol, another dose of lorazepam was administered to Mr. Hill. Mr. Hill did calm down and his restraints were removed, but he still did not sleep. Presenting problems. Grandiose delusion, auditory hallucinations, inability to sit for a while, agitated speech, and easily frustrated. Mr. Hill evidences a few presenting problems. He believes himself to be the new Jesus. He talks about God talking to him, grandiose delusions. While in the emergency room, he could not follow instructions and remained seated, which resulted in him being placed in physical restraints and receiving medications. His speech is difficult to understand, disorganized, and rapid. There are no records of word salad, so while he was difficult to understand and his content was disorganized, It seems that his words were appropriate for the content of what he was saying, and his perceptions were significant. He also had a body odor, even though the smell did not appear to be the result of alcohol consumption, and he appeared disheveled. He also appeared to be experiencing a more depressive state and avoided eye contact, moving his eyes from one object to another, and seemed easily distracted by anything that moved, thus showing a possible deficit in his ability to concentrate or focus on any one thing at that time. His insight and judgment continued to be poor. He showed signs of agitation that manifested physically with him rapidly bouncing his legs up and down, but he remained seated on his own. He also appeared to be easily frustrated when he felt that people did not understand what he was trying to say.
The treatment team feels it's important to identify the strengths that have surfaced in the work with Mr. Hill. He has familial support, as evidenced by his sister appearing at the emergency room within 1 hour of him being admitted, and her being willing to participate in interviews to learn more about Mr. Hill's history. He's employed as a full-time middle school math teacher and completed the academic year recently, and he appears to be substance abuse or use free as it is not a complicating factor in this case, and the sister described that as not being an issue in his life. Regarding family history, Mr. Hill's sister reported that their father may have had a diagnosis of schizophrenia and bipolar disorder, although these reports cannot be confirmed. Mr. Hill was hospitalized 3 times previously for similar symptoms. He had a most recent hospitalization that occurred about 2 years prior to this incident. And in that hospital report, there was a note that indicated he had been hospitalized on 2 previous occasions with similar symptoms.
Mr. Hill is an overweight 34-year-old African American male. He appears to have come from a family with the father having been absent, as his sister informed the staff that she had not seen their father since she was a child. Mr. Hill is college educated and is a mathematics instructor at a middle school and has just completed teaching 1 full semester of math. There is no report that Mr. Hill has been married or that he has any children, nor was his sexual orientation referred to. There was no mention of any religious beliefs or national ancestry for either himself or for any other family members. There is a reported possible history of mental illness on his father's side, schizophrenia, and bipolar. According to Fogel, Nazir, Hirapara, and Ray in 2020, one possible issue of cultural concern is that African Americans are more likely than white people to be diagnosed with schizophrenia even when displaying the same symptoms. This assertion has been supported by Donald Hilty in 2014 when he noted that African Americans and Latinos are much more likely to be diagnosed with schizophrenia. As a result, Hilty notes that Mr. Hill, as an African American man, is more likely to be prescribed an antipsychotic medication, and he is more likely to be sensitive to the effects of that medication. In Mr. Hill's case, he had been prescribed olanzapine in the past, and that medication is noted for including being overweight as one of its side effects. The government also lists other possible side effects, which could include difficulty falling asleep, unusual behavior, and depression, according to Medline Plus in 2020. Additionally, the lack of any significant amount in his blood and his ability to accurately recall facts, such as the police officers' names, would suggest that he was not experiencing any withdrawals from alcohol. Upon further review, however, his sister provided a little bit of family history, indicating that their father had been called schizophrenic and bipolar. As there seems to have been no contact with the father, it was not possible to receive confirmation on this report or access to any official diagnosis in his family's history. To further complicate matters, Mr. Hill had been prescribed olanzapine in the past for schizophrenia, thus further confirming the possibility of this having some form of schizophrenia. Mr. Hill met every criterion for a manic episode. Specific facts, however, argue against any form of schizophrenia. He is a 34-year-old math teacher who has just completed another teaching semester at the middle school level. He had completed an entire semester in a highly demanding and pressure-filled job without showing any signs of decompensation earlier in the semester. According to Hilty, 2014, a person with schizophrenia would be less likely to have been able to do this job for that length of time. Instead, Mr. Hill's symptoms would be more consistent with bipolar disorder, as someone would be better able to handle this type of stress and time than someone with some form of schizophrenia. As such, it is easier to believe that he has bipolar disorder. His manic behavior would coincide with a bipolar episode with a severe manic episode. His more psychotic features, delusions, and inappropriate sexual conduct could also be consistent with the mood that he evidenced in the police officers and emergency room staff. The reasoning goes as follows. 1. Mr. Hill's delusions do not appear to be culturally related. 2. There is no biological or physical reason or cause for his hallucinations or delusions. 3. He does not appear to be taking any substances such as drugs or alcohol, which could account for these delusions and hallucinations. 4. His mood, when he was brought in, was expansive and elevated, but this is not what he seems to experience on an everyday basis. 5. This mood is related to a specific instance and not as his baseline behavior. 6. As such, this would appear to be a manic episode, the expansive mood, with certain psychotic features, the grandiose delusion, or bipolar 1 manic episode 296.43, ICD-10 code F31.13 with the specifier V62.29 or Z56.9. Mark presents with symptoms and behaviors consistent with DSM-5 Bipolar 1 Major Manic Severe with no complicating physical conditions. This is based on Mark's meeting 6 out of the 7 criteria for a manic episode on page 124 of the DSM-5, with the severe label based on his initial inability to remain in control of himself and needing to be physically restrained. The specifiers of V62.29 and Z56.9 were chosen as Mark's sister reported that he had just completed a teaching semester, possibly implying that the teaching job may be a new job or a change in a job as found on page 723 of the DSM-5.
Mr. Hill meets the criteria for a manic episode for a diagnosis of bipolar 1 disorder as evidenced by his sister reports that he seemed strange a week earlier. He was arguing with neighbors, claimed he did not sleep, and spoke about his gifts. The criteria for a manic episode says that it must last for at least a week, and Mr. Hill meets this criteria. He also has inflated self-esteem or grandiosity, decreased need for sleep, excess involvement in activities that have high potential for painful consequences, and a flight of ideas or subjective experience that thoughts are racing. Mr. Hill's mood disturbance is sufficiently severe to cause marked impairment, as evidenced by him being brought to the hospital by police officers, referring to himself as New Jesus, running through the ER, having to be put into restraints, and being given lorazepam 2 mg and haloperidol 5 mg. The episode is not attributable to a physiological effect of a substance. His toxicology screen was negative, and his blood alcohol level was 0. An effective assessment tool for bipolar 1 is the Mood Disorder Questionnaire, or MDQ. MDQ was developed by a team of psychiatrists, researchers, and consumer advocates to evaluate bipolar disorder in an effective and timely manner. It is designed to be used only for screening purposes, and it is a self-report instrument that takes around 5 minutes to complete. After positive screening, a comprehensive examination should follow. MDQ is most effective at screening for bipolar 1, mania, and depression, and therefore would be most useful to assess Mr. Hill.
The diagnosis of bipolar disorder 1 for Mr. Hill implies certain health risks. People with bipolar disorder have been shown to have an expected shorter lifespan due to complications from cardiovascular disease and an increased risk of suicide, according to The Lancet. A person with bipolar disorder is at a greater risk of suicide than people with any other mental health diagnosis and are 20 to 30 times more likely to die by suicide than members of the general population. It is estimated that 30 to 50% of all adults with bipolar disorder have attempted suicide at some time in their life. People with bipolar disorder 2 are more likely to attempt suicide than people with bipolar disorder 1, thus indicating a decreased risk of suicide for Mr. Hill. As a result, Mr. Hill statistically has a chance of a lifespan shortened by 10 to 20 years. It is estimated that the cost to American society from bipolar disorders runs over $202 billion per year. The differential diagnosis aspect of Mr. Hill's diagnosis includes his disorganized thought, impulsivity, and psychosis or delusions. The goal for treatments for Mr. Hill should take into consideration prevention of future episodes, such as the ones that had him brought into the emergency room recently and the ones that caused his hospitalizations in the past. The goal should be to reduce his manic episodes and to normalize his circadian rhythm. Lithium is considered to be the gold standard for bipolar disorder treatment, according to McIntyre et al. There may be a neurobiological component to the progression of bipolar disorders, and this can result in the value of different psychopharmacological treatments diminishing over time. Lithium has been approved by the U.S. Food and Drug Administration for acute mania. The Lancet indicates that a combination treatment may be more effective, combining lithium with Mr. Hill's current olanzapine. This may be easier for him to tolerate than adding lithium to his regimen and removing olanzapine, but replacing the olanzapine with a different medication, such as haloperidol or carbamazepine. It's recommended that he remain under olanzapine with the addition of the lithium for his treatment. Mr. Hill should be monitored for side effects related to lithium, such as tremors, polyuria, cognitive impairment, and weight gain. The weight gain and potential for polyuria are especially important considerations in that either could indicate the possibility for diabetes, and given Mr. Hill's elevated blood sugar levels and obesity, these will need to be monitored closely. Kidney disease is another consideration to watch for, especially given Mr. Hill's elevated blood urea nitrogen levels from his recent lab test. According to The Lancet, however, the risk of renal failure are negligible when compared to the general population.